My topic today is, as Dr. Delahose mentioned, pre-placement and fitness for duty, a framework for evaluation. I have no financial relationships or conflicts of interest to disclose. In an effort to make this session more interactive, I would ask you all, if you can, to take out your cell phones and just point your camera at the QR code, because during this session, I will be asking maybe about 5, 6 or so questions throughout the talk, just to make sure that you're still with me, awake, paying attention, that sort of thing. So I'll give you a moment if you can just take out your cell phone, point it at the QR code, and then we will get started in just one moment. Okay, so I'm going to start out with a test question. It's summertime, and so many of you are going on vacation at this point in time. So just a question, what do you like to do on vacation? Just want to make sure that this is working. So as you point the camera to the QR code, the options should come up for you to choose. Please feel free to just, pick something. I'll give it another few moments. And okay, so, all right, most of you like to travel. I guess responses are still coming in, going to the beach, rest, experience nature, attending cultural events. It's all good, I say. Vacation is a must, and whatever you choose to do on vacation is perfectly fine. So thank you for that. Now we realize that it's working. So just to get into some educational objectives for the session, at the conclusion of this activity, I hope that you'll be able to describe what the point of the pre-placement and fitness for duty is, identify any steps to evaluate candidates and also employees in their ability to perform the roles in which they were hired to do. The goal of pre-placement and fitness for duty evaluations is really to place and maintain employees in an occupational environment adapted to their psychological and physiological capabilities. You also want to determine whether an individual is fit to perform his or her job without risk to themselves or to others. So the first quiz is coming up. So the question is, what is a pre-placement examination? So go ahead and just answer one of the choices there. If you think it's an exam an employees can use to deny work to applicants with disabilities, evaluation that happens once an employee has been working on the job for a while, or a targeted evaluation aimed at being job-related and consistent with business necessity. I'll give you a moment for that. Okay, so far we have a few responses. A few more I see coming in. Okay. All right, so the correct answer is a targeted evaluation aimed at being job-related and consistent with business necessity. So before employment, employers may not make medical inquiries until a job offer has been made. So the job offer is contingent upon the results of the medical examination. Pre-placement exams occur at the beginning of a work relationship with the employer, and it's really a step in the process of onboarding an applicant. It's supposed to be a targeted evaluation aimed at being job-related and consistent with business necessity. A fitness for duty examination, on the other hand, determines whether a previously hired employee who is able to perform the essential functions of the job are still able to perform the essential functions safely. So, question, when are fitness for duty examinations performed? I'll give you about 10 seconds or so to answer. Is it while assessing an employee injury? Maybe when somebody comes in for a respirator fit evaluation, when an employee gets into argument or with a coworker on the job, or frequently calls out late, any of the above. Okay. All right, so the majority of you got it right. So any of the above may trigger a fitness for duty evaluation. It can often be triggered by a routine exam. Sometimes you're seeing somebody for a medical surveillance exam. Maybe you're evaluating them for a respirator fit test. maybe in the course of a work-related injury evaluation, and something may come up where you feel that their ability to perform their job is in question. And so it kind of shifts to a fitness for duty evaluation. Also, it could be triggered by the supervisor. Oftentimes, the supervisor will send an employee in because, you know, maybe they've gotten into a fight with their coworker, or maybe they're constantly late or not showing up for work, whereas before they were. Maybe there's just some change in their demeanor at work and there's some cause for concern. So any of these can trigger a fitness for duty examination. Definitely, you know, in my previous role when I was working at the sanitation department, any workplace accident of a sanitation worker would trigger a fitness for duty evaluation, or any sort of you know, egregious error in job performance would also trigger that. Also, sometimes it may be triggered if there's a concern about the employee themselves. Maybe they've expressed self-harm to the supervisor on the job, and that may trigger a fitness for duty examination. So really any of these may trigger that. So some basic kind of steps when you're performing pre-placement and fitness for duty examinations. I'll go through these more in detail, but this is just a kind of high-level overview of what we'll talk about in a moment. So first, you want to assess somebody's ability when they're coming in for a fitness for duty evaluation. Part of that is knowing the essential job functions. Now, you could maybe know this in various ways. Sometimes you may possess your own knowledge of the job function. For example, if you're a physician evaluating another physician, you kind of know what the training is, what the job entails, that sort of thing. But if it's something that you're not familiar with, you'll definitely have to find out more by either asking the employee, or you can ask the supervisor or the labor department if that is still not available. It's important to note that the essential job functions should be the fundamental duties of the job. It's not something that you only do occasionally, but it's basically what you do the majority of the time that you're at work. Job descriptions and job functions should include the physical requirements as well as the environmental factors of the job. And if all else fails and you don't have this information from either the supervisor or labor or things like that, you may have to do a site visit to just obtain more information for the job. So I'm going to show you a series of pictures. These are all hospital housekeeping workers. So just make note of kind of the activities that they're doing, and think about what types of essential job functions or environmental exposures do you see of a hospital housekeeper. And I'm going to ask you to type in what you're seeing in that picture. And I'll go back to it in a second just so you can take another look. And then, if you will, just type into into the app there what sort of essential job functions that you're seeing there. Or environmental exposures as well. Okay, right, we see bending. As you keep typing, the words will show up on screen. So I encourage you to keep typing. Yes, exposure to body fluids, chemicals, anything else? Yep, work with chemicals, sure. Okay, chemical cleaners, so chemical seems to be an outlier. Pulling, lifting, absolutely. Anything else? Infectious disease, correct, yes. Slip, okay, I imagine you mean slip and falls, yep. Yep. Okay, great. So the majority of you got exactly what's going on in terms of the essential job function. So definitely as a hospital housekeeping, you have to be using the correct cleaning chemicals for whatever designated surface you're working on according to OSHA regulations and the hospital requirements. You're going to be transporting also carts of cleaning supplies and linens and around to the different hospital stations and floors, and you have to be able to be able to pull and push that weight. You have to correctly use and maintain cleaning equipment. You may be reaching with your hands and arms. You may be stooping, kneeling, standing, crawling just to get into the spaces to clean the adequate areas. And it involves frequent walking and standing. So the majority of you correctly identified those. And just to talk about the environmental exposures of a hospital housekeeper, obviously you have various temperatures. You all know that, working in the OR tends to be very cold in there. There are other areas of the hospital, maybe that's not well ventilated, that tends to be very hot. So there is variable temperature as well as variable noise level in the hospital. There's exposures to fumes, odors, hazards, dust mites, chemicals, and biohazards. So those are all things to keep in mind if you are evaluating somebody with this job title of the essential job functions as well as their exposures. I'm going to give you another example, and this is of a nurse. So just take note. These are various depictions of nurses doing their job. And then in a moment, I'm going to switch and ask you to type in the chat, what types of essential job functions or environmental exposures of a nurse can you identify in the previous pictures? I'm going to give you a moment to start typing. Lifting, yeah, absolutely. Infections, right. Needle sticks, sure. Needle sticks injury, prolonged standings, medications, right. Great. Heavy lifting, pushing, pulling, pushing, bending, right. Mentally draining, yes, that's important. Exposure to ID. Okay, great. Great. So you guys got it all mostly. So essential functions of a nurse, of course, they record medical information, they're taking, monitoring vital signs regularly, operating medical equipment, they may be administering medication, drawing blood, giving immunizations, assisting the physicians in surgeries or procedures, they're involved in wound care, they're moving, transporting patients, and then maintaining inventory. And environmental exposure is, as part is important. As some of you correctly identified, there's infectious disease exposure, there's toxic substances exposure. In one of the pictures I showed, there was a nurse working with anti-neoplastic agent. And so that's something to be mindful from that, nurses who work, in oncology or with any of the cytotoxic drugs, they can be associated with mutagenic, teratogenic, carcinogenic effects that we should be aware of. Also, any nurses that work in areas that, they need to sterilize equipment, so such as the surgical, specialties, urologies and all of that. Some of that equipment used to sterilize, the chemicals used to sterilize, such as ethylene oxide, can also be, toxic to people. Radiation. Nobody mentioned this, but, nursing staff may be exposed to radiation. Let's say you have a bedbound patient that they're getting an x-ray taken. They may be helping to prop that patient up for x-ray and get exposed to radiation. There's also patients undergoing cancer treatments or radiation treatments, and they may be exposed to the radiation as a result of that. There's also physical exposures. A lot of nurses are involved in helping to move the patients, and that is prone to back injury. There's variable noise levels as well in their environment, and as somebody correctly identified, there is psychosocial exposures such as stress, the shift work, and workplace violence that our nursing staff deals with. So as you evaluate our nurses, you definitely have to be aware of these sort of, environmental exposures as well as essential job functions. So how do you approach after you already kind of get a sense of what it is somebody does with their essential job functions? The next step is to take a history. So some of this information can be gathered by questionnaire, and we do have a questionnaire here at EHS, which you all are familiar with for pre-employment. And this is the questionnaire here you see. So it asks a set of screening questions, about different areas, systems of the body, your vision, your hearing, your heart, your lungs, your movement, your strength. And really it's to help you in taking your history. So while some of this information can be gathered by questionnaire, keep in mind if somebody answers yes or no, that's an opportunity for you to probe further and to see if there's anything else that needs to be explored in their history. So a careful history can help determine medical impairments. which is something that definitely we have to be aware of when we're assessing these employees for either coming on the job or remaining on the job. A history should be related to the ability to perform the job. So, for example, if your job function includes driving, you want to ask them about their ability to drive, or they're sleeping when they're driving, that sort of thing, to make sure they don't have undiagnosed sleep apnea or something like that. If somebody's main job function is sitting or standing for long periods of time, you want to ask about their ability to sit or stand for long periods of time. And this is a questionnaire I just showed. So the next step would be physical exam. So physical exam should be targeted, again, to the necessary functions of the job. All applicants should be given the same type of exam, but that doesn't preclude you going further and probing further should something arise on that exam. And this right here is just an example of our physical assessment exam. You may need to do some work-related tests. Very often this includes just CBCs, chemistries, maybe involves a UA. In certain cases, it may need x-rays. There's also vision testing that can be done. Some environments, they use Ishihara testing. At my previous employment, we used Snellen. Audiometry is something that sometimes is used in a pre-employment environment for certain professions. And in some professions, depending on what they do, especially somebody like a firefighter, they may involve functional assessments like strength tests, barometry, peak flow, tests of physical endurance, and then there's also drug and alcohol testing. Of note, drug and alcohol testing is technically not considered a pre-placement screening because you can do it before the job offer has been extended. So in certain professions, there is the ability to utilize medical standards. So for instance, when I was at the sanitation department, that was under DOT regulations. So we had the DOT standards to refer to. For firefighters, they have the NFPA. For pilots, they have the Federal Aviation Administration. And these serve as guidelines and maybe, will specify what a sanitation or firefighter, can work, maybe medications they can or can't take. And these are very specific for these industries. But what do you do if you don't necessarily are screening somebody in one of these industries? There are other things that you can do and other resources that you can look at to help guide your decision-making, such as, the use of specialists, looking up, reference articles or up-to-date or things like that to help guide your decision-making about whatever it is you're trying to assess. Also, you can keep in mind your own workplace team. Like you as the provider have access to human resources, labor relations. Maybe you need a clarification about what it is exactly somebody does. Maybe you want to inquire about a work performance. So these are people that you reach out to. Maybe you need to clarify a legal question that has come up in the case. So remember that you can reach out to these other people to help to formulate a decision, including a supervisor, manager. You might need an industrial hygienist or ergonomist, or environmental health and safety, if there's a question about environmental exposure that arises. So the next step is that we'll do an assessment of risk in these evaluations. And there is a quiz here. So true or false, a risk is anything that has the potential to cause injury or illness to employees. I'll give you a couple of moments to answer. It's really simple, either true or false. Okay, if you could log responses. Okay. Okay, so the majority of you said true. Okay, it's actually false, and I will explain why on this next slide. So a risk assessment. When you're doing a risk assessment, it's important to keep in mind hazards versus risk. And a hazard is anything that has the potential to cause injury or illness to employees. A risk, on the other hand, is the probability of harm occurring from such a hazard, or put another way, the likelihood of injury. So it's, probability, likelihood, and this has to be individualized. It should be based, as we've talked about before, on their essential job functions and the worker's ability to carry out those functions. And when I say it has to be individualized, what I mean by that is it can't just be based on population statistics. You can't say with somebody with a seizure disorder, most people who have a seizure disorder have, 30% risk of, having another seizure within a certain time frame. No, you really have to individualize and assess that individual. Like, how often do they have seizures? What is the sequelae? What happens when they have a seizure? What medications are they on? It really has to be specific to the individual. And so, that will help guide your assessment of this individual's risk in the workplace. So again, this is driven by your own interview, as well as physical exam, the health questionnaire that you may have screened them on, your own labs, your own testing. And you should be able to, from this, to identify the frequencies of, said illness, duration of said illness, the length of exposure to said self-illness. Another example is somebody who's a diabetic. If the diabetes is well controlled, there may be minimal risk in the work environment as opposed to somebody who has uncontrolled diabetes and maybe they have a riskier job function where they may be prone to injury if the diabetes is not well controlled. Just to talk further about risk assessment, because that really is the meat of where we as providers look to, make drive our decision making. Some of the other things you want to consider when making these assessments is somebody's health and safety risk. So what is the probability of an adverse effect on the worker? What is the probability of an adverse effect on the public? Again, when I was at Sanitation, these were sanitation workers who drove on city streets, multi-ton vehicles, so there was definitely a public safety implication. In addition, here, we have doctors and nurses who are our employees that we often see. There is a public safety implication in what they do, right? They really have to be fit to work, well enough to work, because if they don't, they could cause real harm to the patient population and the public at large. So that all has to be taken into consideration when we're considering whether or not they can work. You also want to consider health and safety risk as it concerns infections. The hospital is a very infectious disease heavy environment, and is the employee that you're assessing prone to infections, or maybe they're prone to passing infection. Maybe they're a food handler, and that job function also has implications from their ability to transmit disease to other people who are immunocompromised within the hospital. You also want to consider about how much harm is likely. Is this a temporary issue? Is it a permanent issue? Is it something major? Is it something minor? Is it something that's potentially fatal? Those should all be considerations as you consider risk. And as I mentioned, you want to consider who is affected. Is it the individual employee evaluating themselves, or is it the public at large? In terms of physical and psychological capacity, you also want to consider what the risk is from certain demands. As I mentioned, with certain jobs like firefighters, police officers, there's a heavy physical demand. So if that person is prone to heart disease, heart attacks, that sort of thing, that's something you definitely want to screen for and control for in your assessment of the employee. You want to think about environmental exposures as it relates to asthma, dermatitis, that sort of thing in terms of your assessment. And then the third thing you want to consider in terms of your assessment is somebody's job performance and absenteeism. As I mentioned before, oftentimes that's the reason why somebody's referred for a fitness for duty exam, is that they have a poor job performance, or maybe they're calling out often. And so that is a key piece of information you want to have in terms of helping you make the assessment. Look, sometimes they might just be a disgruntled employee and they're unhappy in the workplace, but other times it may be a true, indicator of a medical issue going on that needs to be addressed and looked into. So as I talk about performance and attendance, it's important that you know about certain key legislation within, the job place. Most of you are probably familiar with this, but, for those of you who may not be or may be new to employee health, there's definitely the American with Disabilities Act of 1990, which everyone should know and be familiar with. Now, its intent was to remove barriers to participation in the workforce against those with known disabilities, to eliminate workplace discrimination based on disability, and to require a reasonable accommodation. So the key thing to note is that it does not prohibit fitness for duty or pre-placement examination as long as they are job-related and consistent with business necessity. It defines disability as a known physical or mental impairment that substantially limits a major life activity. And it is defined after mitigating measures are taken. So, for example, under the American with Disabilities Act of 1990, if you were legally blind and you then wore corrective glasses and that corrected your sight, you would no longer be considered disabled under the Act of 1990. Now, this is an important contrast as opposed to in 2008 when they later went back and passed an amendment to the ADA Act. And basically, it redefines who is considered disabled under the ADA. So in the previous example that I gave, somebody who was legally blind, even if they wore corrective lenses and were able to now see, they would still be considered disabled under the ADA Act of 2008. It also made the definition for disability less stringent. So now pretty much a lot of things qualify for a disability under the ADA Act of 2008. So things like reading, concentrating, thinking, communications, bodily functions, all of those can qualify as a disability under the ADA Amendment Act. And so it really makes it challenging because, as I said, pretty much anything could be considered a disability under the current regulations of ADA. The important thing to know is that it does not change the existing rules regarding pre-placement and fitness for duty evaluation, so they can still be performed under the ADA. FMLA Act, some of you may also be familiar with. This requires covered employees to provide employees job protection and when they have a qualified medical or family reasons for a leave. And it must allow the employee to return to the same or equivalent job. The New York Paid Family Leave, or PFL, also provides some job protection, some paid times off, and some health insurance. But it does allow for protection from discrimination or retaliation. Workers' compensation, which I'm sure all of you are familiar with, but just for completeness, I included it here. So it is a state-by-state statute, and it provides medical benefits as well as wage replacement for on-the-job illnesses or injuries. And all of this is helpful to know because sometimes I get employees that they're all confused. Maybe this is their first time at EHS. Maybe this is their first injury, and they want to know what to do and what the different, avenues are for them to go down in terms of, either wage replacement, protected time, or getting the injuries and illnesses covered. And finally, you have the EEOC, or the Equal Opportunity Commission, and this is a regulatory body which enforces anti-discrimination law. And so under this body, it's illegal to discriminate against employees because of employees' race, color, religion, sex, national origin, age, or disability. So now that we've talked about some of the key employment legislation, let's just shift gears to talk a little bit about enabling factors. And what do I mean by that? Well, first we'll ask a quiz. What may allow an employee to work safely in the workplace? Is it ensuring that they're being properly treated for their medical condition? Is it speaking to provider to clarify a work restriction, collaborating with labor or employee supervisors on an accommodation request. And you can take a moment now and answer accordingly. Okay, so yes, any of the above will allow an employee to work safely in the workplace. So in terms of enabling factors, when you see an employee, you want to make sure that, you know, like you want to think to yourself, okay, what things can I do? What things can maybe they do to help to get them back to work sooner, or get them back to work safely, that sort of thing. So you want to make sure, are they being treated adequately? I've seen many employees who are being untreated for their medical condition or being undertreated for their medical condition. So that definitely is something to inquire about. And if you have a chance to speak to the treating provider, also something to inquire with the treating provider about. Are they receiving rehab or PT for the condition? Some employees, maybe they say, oh, well, it wasn't approved or whatever, and they never received PT, they never received rehab. Well, it may be important to their condition that they receive such things. You want to, you know, think about any limitations to that employee may have, any restrictions and any accommodations. Be more specific, a limitation is any existing constraints on a patient's physical or mental capacity to perform any required task. So, for example, if somebody, you know, had an accident and now they have a fused joint and they're not able to fully flex, that's a limitation. There's nothing that they can do that would, you know, help that. They're just not able to fully flex or extend their arm. Another example would be somebody who has lost an eye and so now has monocular vision. That is a limitation that they have, and that, you know, there's nothing else that can be done for that. There's some social limitations. Sometimes I've seen employees who are on the autism spectrum. They're very sensitive to light, to sound, on other external stimuli, so that they have a difficulty working under those conditions. So that is a limitation that they have, and maybe as a solution, there is an accommodation that can be made for them to control for those sort of environments to allow them to work. There's also people who may have limitations due to allergic, you know, triggers, you know, such as a person who has irritant asthma, and specifically when they work in a given environment, they may be unable to work because it triggers their asthma. A restriction is what patients should not do, even if they think they can. So, you know, an example of that would be somebody who maybe they're returning from surgery, post-op, and then maybe they had a knee replacement, and now they want to get back to work as, you know, a hospital cleaner. And, you know, as we've discussed, that involves a lot of pushing, pulling, and so it may not be in their best interest to get back to full duty. In which case, they would need to have some sort of restrictions to them returning back to work. The restrictions should be specific. It should be, you know, what exact weight, you know, can they lift? Can they push? Can they pull? What, you know, what things they should be avoiding, you know, in their restrictions, their prescriptions for restrictions, so to speak. It also should include a date, end date for the restriction. Okay, and then we also have an accommodation. So an accommodation is an adjustment to the work environment that enables the disabled individual to perform the essential functions of the job. So as I mentioned for the previous example, perhaps that person who is on the autism spectrum who cannot function in certain types of external stimuli environments, an accommodation for them would make sense to enable them to work in the job by, you know, something like, oh, you know, needs to have a restrictive, you know, light. Maybe they need to be moved to a less trafficked area so they can work quietly. Maybe it involves, you know, having their own office, you know, something like that. Could all be examples of accommodations which could be made to allow the employee to work in their environment. Now, it's reasonable if it occurs because, you know, it's basically something simple that can be done in order for the employee or the candidate to perform the essential job functions. it's considered unreasonable if it causes an undue hardship on the employer, usually due to the nature of the request or the cost of the request. If, for example, they're asking for a whole other, person to help them, maybe they have difficulty seeing and they're asking for, a person to lead them around the hospital, so to speak, it may be unreasonable in that it incurs an additional cost on the employee and they're not able to support that. So just keep things to keep in mind. So there are some tools that, we can help the employee achieve to help get them back to work and enable them to go back to work. So just keep those in mind. And sometimes you may have to guide the treating physician in terms of what may be best. Oftentimes the treating physician is not familiar with what the employee does. They're not familiar with the specific workplace issues. And they may not be familiar with what accommodations could be helpful or could be available. And so part of your role is, when you're speaking with the treating provider, is that you could provide that information and, help the provider get to that, that point, where they would, be okay with an accommodation or a restriction, in terms of getting the employee back to work. Okay, and so then finally, after you've gathered all of that information, you're ready to make a determination. And really your determination is going to be usually one of three things, three broad categories. So first, you'll be medically cleared for hire, you're cleared for duty. So that means you have no restrictions that would preclude you from working the essential functions of the job. Or sometimes you're cleared, but you're cleared with restrictions or with accommodations. And we've talked about the distance between the two, and that basically indicates that the candidate can perform the essential job functions with some work modifications. And as I mentioned, those restrictions or accommodations can be temporary or permanent. And then, lastly, medically not cleared for duty or hire. The candidate or their employee is unable to perform the essential functions of the job. It's important, I think, I might have skipped over this, but just to mention, a lot of these evaluations are fraught with a lot of, fear and consternation on the part of the employees. Sometimes the fact that they're being called down to employee health is very anxiety-provoking for the employees. Sometimes maybe this is the first that they're even talking to somebody about a medical issue that they've been having. So it's important to definitely deal with these employees with utmost care and respect, and recognize that they may be afraid to talk to you, at least initially, about some of the things that have been going on. Sometimes they also fear, being fired. They fear that this is going to affect, any maybe job promotions they may be up for. And then in some employees, it involves some anger and harsh words on their part as to, why they're being evaluated. Sometimes they may threaten, if this is an EEOC violation, this is discrimination, they may threaten you personally in terms of your, medical license. But, it's important just to keep in mind where the employee's perspective is coming from, and a lot of it is coming from fear. And it may be helpful just to kind of address that and, let them know that you're really there to help them, to hear them out. But, and it's not a purely a punitive evaluation why they're being sent to employee health. So those are just some things to keep in mind. And as I wrap up, just to talk about putting this all together. So this is a summary slide of everything that we've talked about. And hopefully this has provided for you a framework of how to think about assessing these employees that come in for pre-placement evaluations as well as for fitness for duty. So first you want to assess their ability. That involves knowledge of job functions, your personal interview with them, any medical relevant examinations, any tests, any standards, any consults, any research, literature research you want to do about, gathering information about their ability. Then you want to assess the risk. Remember, you want to assess the risk to self, risk to others, considering job performance, their attendance, and then also considering any enabling factors, such as, are they on the right treatment? Is there any restrictions, any limitations that could be helpful for this employee, any accommodations? And then when you've gathered all that information, you go ahead and make your determination with the determinations we've talked about, cleared, either cleared with accommodations, restrictions, or not cleared. And so I hope with that you have a good framework for how to approach these cases. And if you approach it in a systematic way, you know, eventually you will come up with the appropriate solution for these employees. Remember always to just be in the mindset of we're trying to help the employees as much as possible, but we do need to come to a determination, you know, on these cases and employ as many tools as we have at our disposal in order to do so. So with that, I am going to stop sharing and see if there's any questions or comments.